Welcome to SLP Nerdcast. I'm Kate.
And I'm Amy, and we appreciate you tuning in. In our podcast, we review and provide commentary on resources, literature, and we discuss issues related to the field of speech-language pathology.
You can use this podcast for ASHA CEUs. Visit our website for other courses, including live courses, webinars, blog posts, and SLP Masterclasses available for graduate level credit. SLP Nerdcast is committed to improving continuing education in our field through affordable pricing and open access libraries. You can support our work by leaving a review, referring a friend, making a one-time contribution on our website, or subscribing. You can subscribe for as low as $7 a month and get access to monthly Q&A sessions, exclusive content, discounts, and a resource library of downloads, freebies, and printables. Want unlimited access to ASHA CEU courses? There's an affordable subscription for that too. For more information, visit us on our website or contact us anytime on Facebook, Instagram, or at info@slpnerdcast.com. We love hearing from our listeners, and we can't wait to connect with you.
And just a quick disclaimer, the contents of this episode are not meant to replace clinical advice. SLP Nerdcast, its hosts, and guests do not represent or endorse specific products or procedures mentioned during our episodes unless otherwise stated. We are not PhDs, but we do research our material. We do our best to provide a thorough review and a fair representation of each topic that we tackle. That being said, it's always likely that there's an article that we've missed or another perspective that we haven't shared. If you have something to add to the conversation, please email us. We love hearing from our listeners.
Hello, everyone, and thank you so much for joining us today. Before we get into this week's episode and welcome our guests, there are a few updates that have come up since we recorded this episode. We recorded this episode about 6 months ago, and funny enough, in the episode, we talk about how quickly things in this landscape change. And lo and behold, since the episode was recorded, there have been several resources published that we wanted to make sure our listeners were made aware of. At some point later in the episode, one of our guests, Barb Worth, mentions that there is not a published voice questionnaire for non-binary folks, and that is actually no longer true. There is now a published voice questionnaire for people who are non-binary, and that reference and link is in the show notes. It was published by Shefsik and Tsai in the Journal of Voice in 2021. There's also a new organization called the Trans Voice Initiative. And the Trans Voice Initiative is an organization that seeks to open the gates for intersectional trans leadership in the field of speech and language pathology. Their goal is to ultimately improve the quality of care to the transgender community. And you can learn more about their work at www.transvoiceinitiative.com or on their social media channels at Trans Voice Initiative. And finally, one of our guests, AC Goldberg, is the founder and co-owner of Transplaning. And we've mentioned the Transplaning resources on this podcast before. AC has launched a 3 graduate credit course in partnership with Fitchburg State University on intersectional cultural responsiveness in speech and language pathology. Through the first part of this episode, you will hear us talk a lot about the importance of cultural responsiveness on this topic. So if you're interested in doing a deeper dive and improving your cultural responsiveness, this course is going to be offered for 3 graduate level credits and a whopping number of ASHA CEUs, something like 70 hours of continuing education. So if you'd like some more information about that, there's also a link to that in the show notes, or you can learn more at transplaning.info. There's also going to be a new organization coming out soon called the Credit Institute, and CREDIT stands for Culturally Responsive Education, Diversity, and Inclusion Training. So check out those resources. We wanted to make sure that our listeners had the most updated information. And without further ado, here is our episode with our guests, Barb Worth and AC Goldberg. We are so excited to welcome today's guests, 2 lovely individuals who have been on the show with us before. Welcome, AC Goldberg and Barb Worth.
Thank you.
Thanks for having us.
So AC and Barb, you are here to discuss diving into gender aligning voice work, underlying principles and practice. And before we get started, can you tell us and our listeners a little bit about yourselves?
Sure. I am Barb, and I have been doing this type of work for the last 10 years or so. And I've been a speech pathologist for a little bit longer, like going on 27 years, which is absolutely crazy. And so I am so happy to be here because this is something that I feel incredibly passionate about. And I started gender aligning voice work about 10 years ago in a medical setting, but I have switched and I now work at Emerson College, both as a clinical and an academic instructor. And I focus almost exclusively in the area of gender aligning voice work. So I think about myself as sort of teaching and training the next generation.
That's so awesome. What about you, AC? Tell us everything.
Uh, where should I start? I am AC Goldberg. I'm a speech language pathologist, and I have 17 years of experience now, over 17 years of experience, which is so alarming at this point. And I have just made the transition from being a school clinician with a private practice on the side to working for a private practice full time, where I'm doing mostly gender voice modification. And I am the founder of Transplaning, which is a cultural responsiveness training platform where I offer intersectional educational opportunities to speech language pathologists and other clinicians who want to learn more about how to best serve the people that we see as SLPs in any setting that we work in.
And for our listeners who may or may not have heard you on our show before, do you want to tell us a little bit about Transplaning and the resources that you have available? Because I feel like it really is a wealth of information, and everybody who's listening should know that it's out there.
Sure. Well, Transplaning is now an interactive educational website that offers both live and pre-recorded continuing education opportunities, where you can come and listen to me talk about gender and considerations for working with trans and gender nonconforming people in the whole field of being a speech language pathologist, whether you're encountering us in a voice setting or you're encountering, and I say us because I am a trans person, but whether you're encountering a trans person in a voice setting or just, as a student in your school, how to best be responsive and make sure that your space is microaggression free. And in that vein, I offer this intersectional education on my platform where I invite SLP speakers of all backgrounds to come and speak about their experiences and how to best serve people from their populations as an SLP. For example, recently I had Joshua Allison Burbank, who is a Navajo SLP, and that was incredible. And I would highly recommend anyone who is tuning in to listen to that. I've had Vivian TC come on and talk about being an autistic SLP. I have had so many different, I can't shout out to everyone, but what I would love to any listeners to do is actually have sent a discount code for 50% off of monthly memberships to Kate and Amy over here. So you'll find it in the notes of this episode, and you can subscribe for a low monthly fee and have access to all of this continuing education. It's all intersectional. And, really it's going to make you a better clinician to learn about the people that we work with.
Thank you so much. You talked to us a little bit in a previous episode and gave a discount to our listeners, and it's just so incredibly generous. And having, really gone through your website thoroughly myself, I can't say enough about how many resources you really have on there. And one of the things that we're passionate about doing here is connecting people with resources to continue their learning. So thank you for everything that you do and all the resources that you have. So we're really excited about today. For those of you who are listening and hearing AC and Barb for the first time, they have been with us here once before. The last time you guys were here, your focus was on cultural responsiveness, and today is sort of the second installment of that, and your focus is going to be more diving further into the voice modification aspects of what you do. And we're really excited about it. We've had lots of listeners write in looking for this information. Before we get started, I do have to read our financial and non-financial disclosures as well as our learning objectives for the day. People do write in and ask me to skip this part. I can't. Asha makes me read it, so I will get through it as fast as I can. AC Goldberg's financial disclosures. AC is employed full-time as a speech pathologist working primarily in gender voice modification and is the founder and co-owner of Transplaning.info. AC Goldberg's non-financial disclosures. AC is a person of transgender experience, which gives him personal perspective. Barb Worth's financial disclosures. Barb is a clinical and academic instructor of communication sciences and disorders at Emerson College. She instructs students in the delivery of voice services to all populations. Barb Worth's non-financial disclosures. Barb has a decade of experience working with the TGNC population. Kate, that's me. My financial disclosures. I'm the owner and founder of Grandbois Therapy and Consulting, LLC, and co-founder of SLP Nerdcast. My non-financial disclosures. I'm a member of ASHA SIG 12 and serve on the AAC Advisory Group for Massachusetts Advocates for Children. I'm also a member of the Berkshire Association for Behavior Analysis and Therapy, Mass ABA, the Association for Behavior Analysis International, and the corresponding Speech Pathology and Applied Behavior Analysis Special Interest Group.
Amy's financial disclosures. I am an employee of a public school system and co-founder of SLP Nerdcast. And my non-financial disclosures are that I'm a member of ASHA SIG 12 and I serve on the AAC advisory group for Massachusetts Advocates for Children.
Okay, slightly more fun than financial and non-financial disclosures. Learning objectives. Learning objective number 1. Identify at least 2 steps you can take towards cultural and clinical competency in the area of gender affirming voice and communication training. Learning objective number 2, describe at least 2 components of gender affirming voice and communication evaluation. And learning objective number 3, describe at least 3 potential therapy target areas for a client receiving gender affirming voice and communication training. Okay, all the boring stuff is over. We got through it.
The good stuff begins now. AC and Barb, why don't you start us off by telling us just a little bit more about cultural responsiveness within gender affirming voice and communication training?
So, I think that if you're listening to this episode right now, it would really be a great idea to go back and listen to our first episode, because we really covered a lot in that episode that, we don't necessarily have to cover again, but that really, if this were courses in order and there were a prerequisite, that would be the prerequisite to this. And, it's something that you can't just learn once. It's an ongoing practice. So the practice of cultural responsiveness is a lifelong commitment to learning and continuing to learn about other people, not just a one-time course about, issues in bilingualism, but really learning about every single population you could serve to the best of your ability, so that you're able to bring what you know about that person's history into your treatment, so that you actually are able to form a better clinical relationship because you actually understand where the person is coming from. So, it's really important that you go ahead and engage in the practice of cultural responsiveness, and that you go ahead and listen to our first episode. It's really important to learn all of the most current terminology, but terminology that Barb and I use today might be outdated by the time you listen to this episode. That's something that happens. I'll write an article, it'll get published. By the time it's published, the terminology is outdated. That is one of the things I love most about language, is that it's dynamic and changes over time, and this language is rapidly evolving. There's so many resources that you can kind of dive into in the area of cultural responsiveness. You can join me on my Transplaning platform. There's, what is that Facebook page called, Barb? The
Gender spectrum, voice and communication.
There are books that you can purchase, and you can do some learning just about the trans population in general by visiting a site like Listen or GLAD, or even the Trevor Project, just to kind of get some background information if you haven't listened to our first episode.
Thank you for that reminder. I think that's really important. And for anybody who's interested in listening to that, it was published a ways back. Go take a listen.
So I'm gonna talk a little bit about some terminology. I'm gonna give some reminders. So gender is not something that you can tell by looking at them, and it's never something that you should assume. People have a sex assigned at birth, and along with that comes a gender that's assumed at birth, which is a set of societal constructs that somebody kind of puts on them. It's a set of expectations that somebody puts on them based on the sex that they're assigned at birth. So, you've got a sex assigned at birth, a gender assumed at birth. And when you are transgender, that means that you don't feel comfortable conforming to those expectations that people place on you based on your gender assumed at birth or your sex assigned at birth. You might be gender non-conforming, which means that you don't fit squarely into sort of any gender box. You might have a non-binary gender, which can be defined really broadly as just a gender that, is neither male nor female. It could be something that has nothing to do with either of those, or it could be a combination of any of those things. That's very unique and individual. But, all of what's most important is that if you're dealing with a patient, client, or student who describes themselves as transgender, or having a sort of gender that is neither male nor female, that you mirror their language. And if you misgender someone, it's really important just to move on. Don't apologize profusely. This kind of looks like this, I met Barb the other day. She came into the clinic, and it's a really quick correction if you can catch yourself. I don't say, oh my gosh, I'm sorry, because that really puts the burden on Barb to be like, oh no, it's okay. When really, Barb doesn't want attention called to that. Barb just wants to be gendered correctly. And I modeled that I knew the correct pronoun, and then I moved on. And that's what you really have to do if that happens. It's an important reminder.
So one of the questions that I get a lot is, wow, it's so cool what you're doing. That sounds so interesting. How can I start doing that? I really would like to delve into this area of our field, which is a relatively newer area. And just like any other area of our profession, it's so important to develop competency. And we've talked about cultural competency and responsiveness, but how do we become clinically competent in this area? So, I think first and foremost, I think it's really important to understand the function of the voice. I come from a medical background. I was lucky in that I had training in voice and anatomy, physiology, but also in voice disorders. And so, I performed laryngovideo stroboscopy and comprehensive evaluations. So I come from that perspective. And I have to say that I really appreciate that I had all that training, because I think that it really helps me to understand, what we may be doing when we are asking someone to make some modifications to this beautiful, beautiful structure and function of the larynx. So, I think that, that first and foremost, dive into your voice textbooks. Go back to, voice 101 that you took, and take some courses. And we're going to talk later on about specific courses and things that you might choose to do in this specific area. One thing that people ask is, how do I find a mentor? How can I find somebody to help me along the way? And, I have to say that most of us in this area are thrilled to help others. That's part of the reason why AC and I are doing this today, is because we want to spread the good news, but we also want people to appreciate what a wonderful area of our field this is, but also really impress upon people how it's important, to really know what you're doing, right? So, finding a mentor is not always easy, but, AC, I don't know if you want to sort of tell our story, how we met.
Oh my goodness. Well, we met over at Emerson.
We met over at Emerson, right? So Emerson,
Oh my gosh.
AC was interested in learning a little bit more about this area, and had done some observations of my work, and we pay it forward. Now AC's doing this type of work 100% of the time. I'm not only mentoring other graduate students, but I'm also mentoring peers.
And I think it's really important that, there's transgender clinicians now who are doing this work full time, which is wonderful. But we have a lot of cisgender clinicians who, did kind of come, before us and start this work as it was. And I think that very oftentimes people are afraid to ask for a mentor in this work. And I identified Barb as someone who I knew was an ally. We had met before. I said like, hey, I'm going to dive into this work. I've been doing a little bit of it on the side, but I need to see it formally. I need to talk to you. I need to be in the booth with you. And you were like, oh yeah, come on down, like, I'll see you Tuesday afternoon. And you were so welcoming to me as as a peer, and as someone who you were just like, oh yeah, that's great, fantastic, let's do it. And I think that people shouldn't be afraid to kind of dive in and say, I want mentoring in this specific type of work. And there are cisgender and transgender clinicians who are willing to mentor you so that you have sort of the best lens to do this work. And there's plenty of people out there now who know how to do this work, but you shouldn't try to do it unless you actually have experience.
So one of the things that I did maybe 5 or 6 years ago is we sort of developed a peer group. So some of us that were doing this work would meet on a monthly or every other month basis. We would share resources. We would, with clients' permission, we would share voice samples, and sort of having another pair of ears to listen and say, hey, I'm sort of stuck here. share? What should I do? What would you do if this was your client? And then fast forward to a few months ago, one of my colleagues who I had not met at an area hospital contacted me and said, I'd really like to get into this area. And I said, great. What have you learned so far? And so she, through email and eventually a phone call, we started talking and we've reformed our group. And so, we're now going to be meeting on a monthly or quarterly basis and just, again, sharing experiences and supporting one another.
So I love what you're saying about mentorship. I love mentorship. I think it's so important. I think that it's something that our field in general has not embraced enough across all disciplines and all, areas of practice. And another reminder, this is something that we talk about a lot here, is how scope of competency is the ethical choice. So based on our code of ethics, you are really required to gain competency in an area before practicing. And mentorship is one of the best ways to do that. And I'm just so thrilled that you mentioned that. That's just like my tiny little soapbox about mentorship. I'll get off of it now. So as a person, as a clinician, I have zero experience in voice. It is not my area of competency. I took my one graduate school class and that was it. At Emerson, which was a wonderful place. But you were not there at the time. So I'm wondering if either of you can tell me a little bit about, I mean, this is a very generic question, but what is it like? What kind of work are you doing in this world of voice modification?
Oh, it's so fun. I mean, anyone of any gender can seek gender voice modification. Sometimes you've got older cisgender women whose vocal register has changed, who are feeling, uncomfortable. Maybe they're being misgendered. Maybe they want their voices to sound younger. You've got, people who are, trans feminine who want to be coded in all of their interactions as female. They don't want to be misgendered. You've got, trans masculine folks. You've got non-binary folks. You've got people who are gender fluid who want to be able to have different sets. But, really it's fascinating because everyone's voice is completely different. And I am going to dive in and tell you a little bit about the types of people who you might see, because people, when they oftentimes see hear trans feminine voice care or trans masculine voice care, they kind of assume that all female voices are going to sound the same. You're going to have a higher pitch, more frontal resonance, that sort of thing, which we're going to get into. But people who I see could range from a butch lesbian trans woman who doesn't want to seem traditionally feminine but doesn't want to be misgendered, to someone who is trans masculine and gay and doesn't want to be accidentally read as female. There's a lot of crossover there. I've got people on my caseload who their primary goal is to not be misgendered in any interaction, but others who care less about that and more about how they feel about their voice. So, people come for gender voice modification or gender affirming voice modification because there's a discrepancy between their gender presentation, their outward gender presentation, and what's manifested in their voice and communication. Some people complain about strain, fatigue, a lot of effort, and their voices sound thin. They have a hard time projecting. People don't want to be read as the wrong gender in any circumstance. And you have to talk to clients about phone voice and how phone voice is always a little extra. Believe it or not, you all listeners can hear my voice. I am still misgendered on the phone sometimes because I default to, my old habitual polite phone voice. And, I got locked out of my bank account the other day, and I was getting text that someone was trying to tag into my bank account. And it was because I was using my phone polite voice from my old habitual voice, not my current voice that I'm using now. And people try to modify their voices on their own, and they have difficulty because they don't know the proper techniques, and they get harmful advice on YouTube a lot of the time. And Barb, do you want to jump in? Did I move anything? Miss anything?
I think you covered it. I think that, our clients will talk a lot about the anxiety that they may feel. Well, not everybody has anxiety about their voice, but some people do. We hear about, people who say I'm using air quotes here, I pass, because that's a word that I, as a cis person, I wouldn't use unless someone uses it first. One of my clients uses it first. So they might say, I pass until I open up my mouth. And so this is really creating a lot of issues for me. Some people are, I hate to say this, but in all areas of our country, people are feeling unsafe. And so they really might need some help with their voice because they want to feel safe. And some people feel like that they just don't even want to be communicating or talking because the voice that's coming out, it's just, they don't connect with this voice. It doesn't match. It doesn't align with who they are.
You can see gender voice alignment clients anywhere. You could see them in private practice. You could see someone in a medical setting. You can see them over Zoom telepractice, and schools and camps are even getting in on the action. So if you're a school SLP, go for it.
I would know one question is people always ask about insurance. I love to say that the more I'm in doing this sort of work, the more I see that insurance companies are covering this service. So it's really important to have an understanding of people's medical insurance to see if it is a covered service. What I think I cannot say enough about is that we as practitioners must be licensed in the state in which we are practicing and the person resides. Okay.
And that's an important technicality.
Yes, it is very important. And I know that there are people who don't know that, or maybe perhaps are not conforming to that. So I'll say it again. You need to be licensed in the state in which you are residing and you are practicing. You're in which your client is practicing. Kate,
I have a question that might be a little controversial, or maybe an interesting question.
Yeah.
It recently came to my attention that there are SLPs who are engaging in this work with this community and calling it coaching.
Yes.
And not clinical service. And by calling it coaching, they are skirting around a lot of the liability. Well, supposedly skirting around this issue of licensure and liability.
Well,
and I'm wondering if there is if you have any perspective on that.
Well, AC and I were talking about this yesterday, and yes, it is happening, right? You do not need to be a speech language pathologist to do this work. Okay. So many of the people who were doing this way before I was doing this and way before AC was doing this were not speech pathologists. A lot of them were actually singing teachers.
And actors too.
And
voice
actors.
coaches.
Right.
And
Voice
actors
coaches.
And voice coaches.
Right.
And they're all also qualified to do this work. But we can't unbe SLPs in order to do this work. So we have to act within our ethical code. At least I feel that way in terms of where sort of that boundary is, and I would feel uncomfortable if I would not practice in a state where I'm not licensed because I am an SLP.
Thank you for answering my question. I think it's an interesting intersection, but moving on. So I'm dying to hear more about, as a person who knows zero about, I want to say I know zero about the larynx. I know more than the average bear, but very little. That part of my brain has I've made room for other knowledge.
All right. So Kate, I want to ask you, do you remember about the 3 subsystems of speech production? Okay.
I'm really glad you're asking Kate this question.
Oh my God. You love it. Oh no.
Okay.
Ashley, if you're listening, please don't take my license away when I can't answer this question.
So it's power, source, and filter.
Oh, I wouldn't have said that. I would have said resonance. I don't know what I would have said.
Well,
I'm just going to keep my mouth shut.
So you're right. So power, respiration, source, the larynx, the vibrating source of the larynx, and the filter is the resonance. So you got a third of it right. Yay!
Yay! I am still an SLP.
So, when we're doing this type of work, there are other things that we address, but those are the three sort of foundational areas. So, looking first at respiration, that respiration is the gas for our voice, right? So, in our practice, we may be, depending upon, what our assessment entails, we may be addressing sort of, some breathing mechanics, some breathing behaviors. We certainly, are going to be addressing the source, which is the larynx. And I think it's important to remind our listeners or to educate our listeners, because they may not know this, about the effect of testosterone specifically on the larynx. Okay. So, a person who has undergone testosterone guided or related puberty, right, will have some changes to their larynx. So the testosterone will thicken the vocal folds, will lengthen the vocal folds, and actually the larynx itself will change slightly in angle so that there's a sharper sort of angle at the front, and it will widen in the back. And those are some of the effects of testosterone for a person who has, yes, AC, you're putting your hand up.
I'm putting my finger up because I just want to remind our listeners that this is someone who has gone through a testosterone-driven puberty at an age where they're still growing.
Yes.
And this is not something that occurs when a person who might be transgender, non-binary takes testosterone. Yes, the thickening of the vocal folds occurs, but the sort of change to the structure there's no evidence that occurs at this point, which can actually result in this thing called entrapped F-to-M vocality, which is, something that we see a lot of the time in the clinic. So, you get a little bit, you get the thickening, but you don't actually get the structural differences. Now, Amy's got her hand up.
Well, I have a question because I've never heard of that entrapped F-to-M. And what does that do? I assume that's a result of the smaller laryngeal structure and the larger vocal folds.
Yeah, I need a whole overhaul description of what that is, because that was way above my pay grade.
You're in our wheelhouse right now.
So
that was way above my pay grade.
Yeah, so the thickening of the vocal folds, but you have the same the carriage is the same. So what is holding the vocal folds hasn't changed. Mm-hmm. So that can lead to some, and I think that there is this misconception, perhaps, that if an individual undergoes hormone therapy and takes testosterone, that voice change will sort of happen and they'll be 100% satisfied. And so there can be some issues with voice projection, and the testosterone doesn't change the resonance structures. And we're going to talk about resonance. So this is probably a really good segue into talking about resonance. So what is resonance? Resonance is, sort of, I like to think of it, it's the color of the voice, all right? So you have this vibrating source, these vocal folds are vibrating, 100, 200, 300, 400 times a second, right? And as that's the source, and as that sound comes through the cavities, that's a complex sound, and certain sounds are amplified and certain sounds are dampened. And so I love to give the example of, it's the difference between ah.
Oh, that was good.
Wow.
I heard
two completely different sounds, but if you were to measure the pitch of that would be the same. Okay, two completely different sounds. So, with some of our trans men or people who are trying to masculinize their voices, after having hormone therapy, sometimes we work with them with regards to their resonance, because their pitch might be satisfactory to them, but we change some of the resonant qualities. Yes, Amy, you have your hand up.
Sorry, and if you can just explain, because it's a podcast, if you can just explain for the listeners kind of what you did there with your facial structure to change that resonance.
Well, I did change my facial structure, but actually I'm going to do it again and not change my facial structure. And so
What do you think she's doing, Amy? I'm so curious as to what your take is, because I know exactly
now it's
what's
your
happening.
turn in the hot
I
seat.
know.
I
I mean,
know.
I feel like it's something happening in like the soft palate area. I don't know.
Your
So it was-
nasopharynx is moving back and forward.
So I was changing some of the, you're right. I was, yes. And I also was changing the tongue. So my tongue for
Days.
my tongue is higher. It's closer
Mhm.
to the E sound. Okay. And when we're feminizing voices, sometimes we look, it's called eification. So we're actually trying to get that brighter quality by changing the height of the tongue. I was also probably changing my laryngeal position as well. I was probably raising my larynx slightly.
That's a lot of things to keep track of.
It is a lot of things to keep track of. And can you imagine getting into sort of, voice training? Imagine trying to take something that is so habituated that you've been doing one way for so long and not even thought about it. And then coming for, to see a voice clinician
No, I can't
and
imagine.
having to start literally at the phoning level, right?
Right.
And make these adjustments so that you can achieve the desirable voice.
What does the evaluation process look like? Like how do you get started?
Yeah, what do you do? I'm very overwhelmed by all of these tiny pieces. There's so many muscles in there.
At the evaluation, we evaluate to, it's not to pathologize a trans person, but it's just to get baseline data on, where they are, ask them where they want to go, and screen them for voice disorder. Sometimes you get someone who, you're like, is that a polyp I'm hearing? Or, is that GERD? Like, do you have some muscle tension dysphonia? Sometimes we get a lot of that. And we refer to an ENT if we think that there's anything going on. Prior to starting treatment, we need to see that strobe, because you really just never know. You don't want to do any harm to someone's voice by saying, okay, you should implement these strategies, in order to modify your voice, but you have an underlying voice disorder. You need to know and treat and deal with that underlying voice disorder before you start. And you can get some instrumentals, but they're not necessary. Amy, here, you have your hand up.
Sorry, I'm trying to remember something that I may be remembering wrong, but if I go way, way back into my grad school days, I do feel like voice is the one area where you kind of always need that ENT opinion before you treat, or is that something I'm inventing?
If someone has a voice disorder and you are, as a speech language pathologist, seeing them for a voice disorder that has been diagnosed by an ENT, yes. However, actually, ASHA's preferred practice pattern is that someone needs to be seen by an MD or medical professional, but it actually does not specify an ENT.
Okay.
So, but in the area of voice modification, the individual does not need to see a medical doctor. However, some insurance companies may require a referral from a medical doctor. So, but that's between the person and their insurer, does not guide our care. But, I do want to say that I came from, sort of a medical background. And so we did instrumental exams on our clients who were receiving gender affirming voice therapy. And I have to say, because I came from that sort of mindset, it was really helpful for me as a clinician to see their larynx in action. And I will say that we did end up diagnosing a lot of people with anything from MTD, muscle tension dysphonia, to nodules, polyps, what have you. So I guess I would just caution and say that while instrumental exam is not necessary, really use your ears and, gather your information. And we're going to talk more about what else goes into the evaluation, but, use that information, and when in doubt, refer out, right? When in doubt, refer out.
I like that.
Always. Yeah. And as one other thing it's making me think of is the important intersection between those clinical referrals and hopefully the training that you've done in cultural responsiveness and competency, so that you don't pathologize the individual that you're working with, and you don't,
Right.
this is disordered, or in any way, advertently or inadvertently, because I think that I assume that can be a very sensitive, or that can be a discussion that takes some competency.
Well, it can be. Sorry, Barb, did I cut you off?
No. I was just going to just make one quick is that it's also, those relationships that you have with other providers are really important. And it's also super important that if you're referring your trans clients to a provider, that you know that you're referring them to a trans friendly provider and safe space.
That's
I'm sorry,
precisely
AC.
So
Safe.
that's
important.
precisely what I was going to say.
Oh,
So
Mind meld.
mind meld as usual. You just have to make sure that you're not referring someone, because trans people come with a lot of trauma into these clinical spaces. We have a lot of medical trauma related to just trying to get competent care. So we might be resistant to a referral. So if you say, like, this is my colleague, like they see all of my trans patients, like, that you will be treated fine in this office, like, then that person might be more likely to actually follow through and then see you back in your clinic, as opposed to someone who you're just referring out for something and they don't really know where they're going or what they're getting. But more evaluation components. You want to do your intake and interview, and you have to have that culturally responsive lens. You need to have consent for all sorts, for the whole interaction. May I ask you some questions? Will you tell me a little bit more about your voice use? You can't. Informed consent is not like a one-time sheet of paper that people sign. Informed consent is an ongoing conversation between a client and clinician that guides a collaborative, like, goal setting agreement that's extremely important when you're dealing with individuals who come from backgrounds that may have experienced trauma. Having your client collaborate with you and set their goals, tell you what they want their voice to sound like. So with regard to the intake, like we talked about in our first appearance here on SLP Nerdcast, you obviously have to come at things through a culturally responsive lens with regard to your intake and your interview. And I'm not going to relive that whole podcast because you really should listen to it. Barbara, you want to take this one?
sure. So, have been some published quality of life measures that I think can be very helpful to get some information, from your clients. There's something called the Trans Woman Voice Questionnaire. It used to be called the TVQ. There is the Trans Voice Questionnaire, which is F to M, which is outdated terminology, but that is one that we are using for our transmasculine folks. Unfortunately, there are no published non-binary measures. Hopefully that will happen in the future, that there will be a quality of life measure that's more appropriate for someone who is non-binary. And then there is something called the Voice Handicap Index, which helps to screen for any kind of a voice disorder, and something called the Reflux Sensitivity Index, which also can be helpful to screen for symptoms of reflux. Super important when you're doing this work that you invest in a good quality microphone, that you have some sort of an app or whatever to do your recordings. There is a free acoustic analysis software program called Pratt, Praat, that I currently use. As I said, free, but it's clunky, so you have to play with it. And I put a shout out to Christy Knickerbocker, who on her website actually has a little tutorial on how to use Pratt, and something like a stopwatch. And beyond that, you don't really need a whole lot of equipment to do this work. The typical things that we measure is maximum phonation time. So you probably remember that from grad school. As long as you can on a habitual pitch. The S to Z ratio, again, you probably learned that in grad school, but just as a reminder, how long somebody can sustain the skinny S is a guesstimate or of somebody's vital capacity. And then how long they can sustain the Z sound, zzz, is a guesstimate of glottal sufficiency. So you want that S and that Z to be pretty much 1-to-1, meaning, the same amount of time on the S as the Z. And that's a screening. And if it's not 1-to-1 and the Z is shorter, you might want to think about that there could be a vocal pathology that's causing the vocal folds not to completely close. So we take, with our sophisticated software programs, we're taking the average fundamental frequency, we're recording during conversations, reading tasks. You're going to do some sort of a perceptual measurement. So if you remember from grad school, something called the CAPE-V, which is a perceptual tool to use. And I also really like to do some of my own sort of informal judgment on things like intonation and things like resonance. So as you dive deeper into this sort of work, you start to think about somebody's intonation patterns. Think a lot about stereotypes, unfortunately, in this area of our profession. But it's stereotypically a more feminine presentation is to have more rising and falling of your voice. And with regards to resonance, we talk about, and again, this is beyond what we can talk about today, but things like chest resonance and head resonance, which are sort of, again, going back to that sort of qualitative aspects of a voice. So we listen for those sorts of things. And then there are other acoustic measures that you can take if you, again, going back to grad school, like jitter and shimmer and that sort of things, not necessarily as important unless you're suspecting some sort of a voice disorder. And then, finally, sometimes we look at some nonverbal communication. So we may look at things like body language and gestures, and also important to pay attention to nonverbal reflexive voicing, such as throat clearing and laughing and those types of things. So after we gather all of this information, I know you want to know, what do you do in a therapy session? So if you go back to that sort of power source and filter that we talked about, so we may do things like working on, and I hate the word diaphragmatic breathing, but I prefer the term lower focused breathing. So making sure that, people are expanding their upper abdominal muscles when they're breathing. They're not using a lot of chest movement. This is going to be helpful for all of our clients. It's really sort of, again, it's the foundation of the voice. And then with regards to looking at the source, so this is when we start to talk about things like pitch. So there is normative data with regards to how we gender a voice and how that matches someone's pitch. So again, going back to sort of, grad school and things like fundamental frequency is how many times the vocal folds are vibrating per second. 200 times a second is the typical pitch for someone to be gendered as female. But really, it's a range, and it's anywhere from about 150 to about 225. So it's this really huge range that we were going to listen to a voice and say, I think that person might be feminine. They may be female. And then when we're thinking about a more masculine sounding voice, we're talking about a voice that's really anywhere from about 100 to 110 to about 140, 150. But there's this really huge area that is what we call sort of the gender neutral area. And that's when all of those other aspects of voice come into play and communication come into play, that we start to say, why do I gender that voice as more masculine or more gender neutral or more feminine? And that's when we start to talk about things like resonance. We start to talk about things like intonation. We talk about, is the voice choppier or is it more blended? And again, a more stereotypical masculine sounding voice is not going to be as blended from one word to another. I was just very blended going from one word to another, which we think about as a more feminine presentation. So these are the types of activities and tasks that we do in our therapy session to help our clients achieve their desired vocal quality. And going back to, what AC was saying about the evaluation, that is the time when we really need to listen to our clients and ask them what they want in their voice. It is not about my perception. It is not about society's perception. It is about their desires for their communication style. And Kate has her hand up.
I do. I have a question. We talk a lot about data collection on here because that's very ethical, making sure that what you're doing is aligned with perspectives and values of your client, because that's evidence-based practice. And I'm wondering if you ever use a recording and have the person listen back to it as like a biofeedback to say, yes, this is what I like, or I don't like this aspect, to give you that feedback about what they would like to change. Because I say that because I'm a speech pathologist, and the nuance and subtlety and specifics of what you're talking about is a lot. I mean,
Okay.
those tiny little subtle things can make a
Yes.
big difference.
And Kate, I'm going to ask you a question.
Oh no.
When you hear, and Amy, I'm going to ask you, when you listen to your voices back,
I hate it.
It doesn't. I think it's,
universal. Universal.
Yeah.
Oh my gosh, that
it
doesn't.
doesn't bother me. Am I weird? Or
Well,
have
you-
I
you
just
also have
listened to my voice because I edit all these audio files? I've just
You've like
listened.
habituated to it.
I've
probably.
habituated to it.
you are really in the minority. Most people hate
Rare.
Why
to
is
hear their
that?
voice. Well, first of all, what did you remember from back in grad school, that we hear ourselves through bone conduction?
Oh, yeah.
Right.
Yeah.
So we're actually not even hearing our
I
voice
knew
the way
that.
other people, right, hear it.
Mhm.
And then we have all the limitations of our recording equipment, right?
Right.
So it's really multifaceted. But the other thing that I do want to bring up is that there is a certain percentage of our clients who have vocal dysphoria. And so for some people, listening back, it's hard enough for them to practice, right, their voice, but to listen back can be really challenging. And so that is something that I really use discretion and would only do following a conversation.
You are
Do you agree,
wise.
AC?
You
Oh,
are
yeah.
wise. I
Yeah.
never would have thought of that.
When I ask my clients, I say, are you comfortable recording your voice? Are you comfortable recording your voice sounding in this new pattern, so you can tell me whether you like the way it sounds? Don't think of it as your voice. Think of it as, is that a voice you can listen to? Because I a lot of clients really, do experience a tremendous amount of vocal dysphoria, and hearing their voice can trigger that. And even though your recorded voice isn't the voice that you hear in your head, it still can really be like murky territory. And, I do take recordings of my clients so that I can, measure progress, but I frequently have clients who don't want that shared with them until they feel like they've achieved where they are, where they want to head with their voice.
Interesting.
I think to answer your question though, Kate, with regards to sort of how do we collect data,
right.
and AC might have a different response to this, but one of the things that I think is really hard for my graduate students is that we do a lot of Likert scales. And so, because it really is ultimately about the client's perception and their desirability and satisfaction.
Mhm.
So we do a lot of like on a 0 to 5 meaning this is, sort of, this is it. This is what you want. Where are you today? Or where were you in that segment? Right. And I think this is probably a little bit different than other aspects of our field.
Oh yeah.
Would you agree, AC? Yeah.
Oh yeah. I mean, I say, how did that feel? And usually there's a numeric scale. How did that feel? Do you want my feedback? And then I might tell them, if they say, that only felt like a 7, how do I take it to a 10? And I have to tell them something like, you have to over cue in order to get there, and then fall back into where you were trying to get to.
Mm-hmm. So with regards to sort of like, therapy techniques that we use, we do a lot of the techniques that you learned in voice class, or that people who work with people with voice disorders use. So things like resonant voice therapy, which is a technique to help to get a more forward resonance. We do things like semi-occluded vocal tract exercises, meaning when I think AC has a straw. Yeah, so phonating through a straw. We do, laryngeal massage. So so one of the things that we teach our clients to do, we may do first, and then we may teach our clients, only with permission, obviously, is to reduce any tension that they might feel, because you can imagine that, this takes some retraining. And I like to use sports analogies, that you have to warm up in order to do this type of work. You don't go run a marathon without stretching, and in theory, right? And that also that there might be some small amount of muscle fatigue, asking your muscles to do something different. And so things like laryngeal massage can be super helpful for the clinician to apply to the client, and also for the client to learn themselves. I think I also, briefly mentioned we do work on things like word choice or body language. We work on, nonverbal vocal aspects like laughing, sneezing, coughing. We have sessions where we, turn on a funny comedian and practice laughing
The
in their
best.
desired voice. Yes, super
Practicing
fun.
laughing, also practicing loud voice, practicing phone voice, practicing polite voice. Sort of, you never think about all those sets to your voice until you're doing this type of work, and you're like, oh, I have a different voice for, when I'm ordering food at the drive-thru versus when I'm calling to make a doctor's appointment versus when I am talking to a friend or when I'm raising my hand in class. They're all different sets, and people need to, make sure that they're comfortable falling into their new habitual voice in each of those sets.
And I think that, we start very much, at sort of at the word level, and then we sort of move along. And I think that it's also really important to remember the cognitive load that it takes in order to be thinking about your voice and formulating language at the same time. So I'll give you an example. I'm so proud of my graduate students because they have formed this really incredible group of actually, it's an interesting group because it's actually people working on masculinizing their voice and feminizing their voice. And they work together on work-related tasks and do work presentations. And so these are people who have been in therapy for, a while, let's say like 6+ months, and they get together and they work on their work voice. So it takes a huge amount of skill to be able to talk at such a high level. I mean, we have like PhD students who are talking about, I don't even know, like astrophysics, right? I don't even know what they're talking about, but it is incredible at this level using their new voice.
Imagine me as a speech pathologist speaking as a speech pathologist using a new voice.
Yes.
It's a thing. I do still have to center myself
Right.
and call my attention to it. I'll find my resonance creeping all the way up, especially at the end of the day. Like I'm right here, and like I just have to kind of like be like, okay, get yourself back down there.
It's a tremendous amount of things to focus on all at once, not to mention
Mhm.
any environmental variable or any, I don't know, other social cues you're picking. I mean, communication is complex on the best of days. So
To try and think about shifting something that's so automatic that we don't, I mean, even just the points that you were making about all the different vocal registers that you're using in all of these different contexts. I've never thought of that, but then you said it and it completely makes sense. But to be thinking about all of those vocal changes all the time, plus your message, it's a lot.
Oh, even think about just spelling your last name when you're over the phone, like, oh, okay, what's your last name? Can you spell that? And then, when you have to spell something over the phone, it's like GOL. And, if you're spelling something in your new habitual voice and you're like, oh my gosh, I have to make all these strange sounds in this new voice. I mean, even spelling can be burdensome when you're using a new voice. We love to empower people to use their new voices across all settings.
And
Sorry, go ahead, Barb.
no, I was going to say, I know that we are running out of time, and I know that we love to empower speech language pathologists who want to do this type of work.
Yes. This type of work is real. It's, for me as a transgender person, it feels so full circle for me to come back and help people in my community feel more comfortable with their vocal presentations. As someone who was so uncomfortable with my vocal presentation for so much of my adult life, I feel like there was I did a lot of work on my voice, and I know what's involved in it. And so having the lived experience of modifying my own voice and knowing what goes into it, knowing the feelings behind it, knowing that somebody can come away and feel like, wow, like I can just walk down the street and talk to someone and not have them know. And that was a big thing for me, is that like I didn't want that to be the focus of my conversation. Like, oh yes, I'm trans, and I would like to order a coffee. I never wanted that to be the focus of my conversation. And I understand when my clients come to me with this sort of like, I want my voice to go unnoticed. I want it to be aligned with the way that I look. I want to feel good when I use it. I want to be able to laugh in public with my friends. I want to be able to feel comfortable communicating across all settings. And I love nothing more than empowering members of my own community to use their voice, their most powerful instrument, to speak up for themselves in all settings. And I love SLPs who provide this work and do it competently, because they're helping people like me who may not have had access to this service years ago. It really wasn't something that we offered as a field. So I'm just so grateful to clinicians like Barb who started this work, kind of in our field way before, I came along and knew that it was even a thing in our field.
And I feel so privileged to have walked this journey. I know it sounds super cliche, but I do feel privileged. When a client comes to my office and asks me to help them in such an incredibly personal, private, intimate part of their intimate, but yet outward presenting, right? Part of themselves. And the absolute joy that people feel as they're achieving their goals. And when they say things like, wow, like I am feeling so much more aligned, and I'm not afraid anymore, or I'm not reluctant anymore to use my voice across all of these different aspects of my life. And I have to say that out of my, as I said, 27 years of work in this field, I have to say it's the most personally rewarding for me. And hence why I think that AC and I want to help to educate others on how to do this type of work.
Well, I can't say anything after that. That was moving and inspiring, and I think speaks to just your level, both of you, your level of knowledge, your level of passion about this topic. And we're so grateful that you agreed to come back and hang out with us, because this is just such a wealth of information. So thank you so much for all of this.
Well, Kate, it was such a pleasure. And, we didn't get a chance to talk about, resources. So I know that we're going to put some information up on the website that will have, books that AC, we call them our Bibles. I mean, they're
The
these
Green
books,
Bible.
the Green
Black
Bible. Yeah.
Yeah.
I mean, these are, resources that we use all the time, various journal articles, websites, and what have you that, sort of have helped us along the way.
We will put all of that in the show notes. So if you're listening and you're out on a run or driving, rest assured that a list of resources and links will all be available in the show notes. So if you, again, for anyone listening who wants to use this for ASHA CEUs, you can go over to our website and purchase access to the quiz. The link to AC's platform, transplaning.info, with a code for the discount will also be listed in the show notes. Guys, this was awesome. Thank you so much for being here with us today. And we are just very grateful for your time.
Thank you.
Thank you so much for having us.
Thank you so much for joining us in today's episode. As always, you can use this episode for ASHA CEUs. You can also potentially use this episode for other credits depending on the regulations of your governing body. To determine if this episode will count towards professional development in your area of study, please check in with your governing bodies, or you can go to our website, www.slpnerdcast.com. All of the references and information listed throughout the course of the episode will be listed in the show notes. And as always, if you have any questions, please email us at info@slpnerdcast.com. Thank you so much for joining us, and we hope to welcome you back here again soon.